Good morning, folks. Welcome. Isn't it nice to see the sunshine out on this nice fall morning? I'd like to welcome you to the first Senior Symposium that is being put together by the Greater Connellsville Chamber of Commerce. My name is Chip Rowan, and I'm with Armstrong, but more importantly today, I'm a chamber member, and I'd like to welcome you on behalf of the Greater Connellsville Chamber of Commerce. Good to have you here. We have a good lineup of speakers. We have a lot of vendors around to provide you with some information that you'll be able to use. And I'd like to thank our sponsors in advance. We have some gold sponsors. It's Advocates for the Aging, Armstrong, the Health Insurance Store, Highlands Hospital, J.D. Montgomery Scott, and Somerset Trust Company for the gold sponsors. And also basket and donation sponsors are, again, Advocates for the Aging, Arch Cafe, Carnegie Free Library of Connellsville, Keys Pizzeria, Lynn's Dairy Queen, and Scottsdale Bank, a division of Mid-Penn. So thank all of them for their contributions, and thank you for coming out. Appreciate you being here. First on our list of speakers is someone that I'm sure many of you know from Connellsville here. It's Aaron Zolbrud, and Aaron is actually with the Health Insurance Store. Aaron's going to be talking about Medicare, right, Aaron?
Yes,
welcome,
I am.
Welcome, Aaron.
Can everybody hear me okay? I got a good voice for this, so I don't think I need a microphone. So I'm Aaron Zolbrud with the Health Insurance Store. I see some familiar faces here today, and we're going to talk about Medicare today. We're here just to educate you a little bit on, basically I want to talk about how original Medicare works, and then I want to talk about the differences between supplements and advantage plans, which is one of the most confusing things for people, is people don't understand or don't know if they have a supplement or they have an advantage plan. And what I found over the years, we've been in business 12 years, and what I found is this is the number one biggest problem that seniors have, is not understanding those two differences between the two. So what you've got today is, in front of you, we're going to go over this. This is the same packet that I would use if you came into the office. This is what we use to educate our clients, okay, when they come in and they want to get some advice from us. So just a little bit about the Health Insurance Store. We've been open for 12 years. You have Annetta Parfit over here, who was my original employee. So we were talking about this morning, back when I started 12 years ago, it was myself, Annetta, and a dog. We had 2 telephones, like 1 fax machine copier. Now we have 4 office locations. There's like 25 employees, so we've barely grown. But Annetta was,
and still the dog.
Annetta was my first one. So let's get started today, guys. And I'll be walking around. So I want you guys just to follow along. We're going to start with the sheet that says, what is original Medicare Parts A and B? Okay? That's where we're going to start. And I'll walk around. If you get lost, and I'll point out to where we're at. So I want you guys to all pretend. I'm sure everybody has a Medicare plan of some sort.
Excuse me.
Yes.
I don't have.
You need one,
Oh,
Tom?
yeah, I was just about to say, you have that one.
Ronnie will bring you one over. Yeah.
I don't have.
Anybody else have one? Another one? We need one more.
Where was the other one? Oh, sorry. Thank you.
So I'm assuming that everybody has a Medicare plan of some sort, okay? Like UPMC for Life, or Highmark Security Blue, or Aetna Coventry, or you might have a supplement like New Era Life Insurance, or Philadelphia American, or AARP. For just 1 second, I want you to pretend that all you had was original Medicare, your white card with the red and blue stripe, okay? So just pretend that that's all you have. That's what we're going to talk about first, how that card works. So first of all, that costs $135.50. That's taken out of your Social Security check, okay? That's to cover Part B. So again, there's 2 parts of original Medicare. Part A, which is your hospitalization, and Part B, which is your medical. So if you had Medicare only, and you wound up in a hospital for any period of time up to 60 days, your bill would be $1,364. If you only had Medicare, again guys, just forget that you had UPMC or New Era or whatever it is. That's what you would be billed. Now, this is kind of weird because if you stayed 2 days, your bill would be $1,300. If you stayed 52 days, your bill would be $1,300. So the person who stays 2 days pays the same amount as the person who stays 60 days. It's very odd. But it's Medicare's rule, we just live with it. I always tell people, if you're going to be in for 1 or 2 days, ask them to stay a couple more and get your money's worth. So that doesn't change until you've stayed longer than 60 consecutive days, which is really, really rare. Okay, and from day 61 through 90, if you look at that, days 61 through, or excuse me, days 61 through 90 is $341 per day. All right, and if you stay longer than 90 days, it goes to $682 per day. up to 150 days. So it's so rare, guys, to be in the hospital, folks, to be in the hospital that long. Although in 2017, we had 2 clients that were in the hospital over 100 days at the same time, actually. The only two clients I ever known of in 12 years that stayed over 100 days, and they were both happened at the same time. It was 2 years ago. But if you would stay 110 or 115 days and only had Medicare, you'd be looking at bills of $35,000, $40,000, $50,000. And that's why we get another plan, right, to protect us from that. So again, I'm not trying to scare anybody, because you all have protection from that, and that's why people come to see us, is to get protection from that. What I'm trying to do, guys, is that you need to understand this is the foundation of everything else we're going to talk about. Medicare is the foundation of everything we're going to talk about, and that's why I go over it first. So Part B is what we use mostly. This is your outpatient, this is your medical, these are your outpatient procedures and services. So look on that list where it says Part B, okay? And these are all your common services like doctor visits, specialist visits. You see testing, that's blood tests, x-rays, CAT scans, MRIs. If you have an outpatient surgery, probably the most common is cataract. I bet you most of you have had cataract surgery in this room. That's probably the most common. So outpatient surgery is something you're in one day, home the same. Okay, carpal tunnel, colonoscopy, something of that nature. Durable medical equipment is also Part B. That's like a back brace, a boot for your foot. And then I had a boot. Didn't you have a boot recently? A boot for your foot, oxygen, a CPAP machine. Obviously, we hope and nobody needs to go through chemo or radiation, but that is Part B, and it can be very expensive. Ambulance services, emergency room visits, and anything else that's not listed here that's considered Part B is all covered by Medicare at 80%, and it puts you on the hook for the other 20%. Does everybody have a pen on them? I want you guys to circle the $1,364, circle that, $1,364, circle 341, where it says Part A, those 3 figures, I want you to circle 1364, 341, and 682. Circle those, and then circle 20%. Okay? Those are 4 out of the 5 gaps in Medicare. All right? The 5th gap is skilled nursing. Skilled nursing is covered by Medicare at 100% for the first 20 days. The next days 21 through 100 are now $178 a day, and that's the 5th gap in Medicare. So those are the 5 gaps. I want you to circle those 4 things because we're going to come back to that, okay? Any questions on how Medicare works? Original Medicare, all right? Let's go to the next page. We're going to talk about supplements first, okay? Supplements are also known as Medigap policies, okay? So you're going to hear me say supplement, you're going to hear me say Medigap. I'm talking about the same thing. I love that name Medigap, right? Because what's it designed to do? Go back to the first page where you circled those. It's designed to cover those gaps in Medicare. That's what they're designed to do. It's pretty much that simple. So you see I've got 4 logos across the top of that second page. Go back to the supplement page where you've got the colored. You have the same, let's see. There you go. Here's in it. Oh, Bonnie, can you get another one over here? We got her the wrong thing. She's got 2 of the same page. Does everybody have this page with ARP on it? Yeah, you got it. You got it turned right there. Yep, that's the page I want you on. Okay, so
Did I have the wrong one?
these ones. Everybody got that one? It's got ARP. Okay, guys, so I've got 4 logos here. ARP, which everybody's heard of. Highmark has a Medigap policy called Medigap Blue. New Era Life Insurance is one of the most popular companies there is. If you're a client of mine, there's a good chance you have New Era or Philadelphia American, and then there's Aetna. Those are just 4 companies that do this, guys. There's probably 100 other ones in the country that sell Medigap policies. The point I'm trying to make is they're all created equal. It doesn't matter what the name on the card is. They're all created equal. In other words, they all cover the same thing, and they all provide you the same access to doctors and hospitals. So Medigap policies can only be sold with letters. Okay? Currently, there's 11 policies you can buy. There's A, B, C, D, F, G, L, M, N, K, and FX. Today, there's 11. And this is why I stay so busy, guys, because it's so confusing, right? All these letters. Makes you want to say some 4-letter words, right? So in 2020, there are only going to be 9. They're eliminating C and F, so there'll only be 9. So there's no fancy names for Medigap like Value or Deluxe or Bronze or Gold. It's those letters. And it's a good thing because, again, they're all created equal. All these companies are going to cover the same thing, and they're all going to give you the same access to doctors and hospitals. I don't care what the name of the card is. So we recommend generally either Plan N or G. And the only difference between companies selling N or G or F or C is cost. That's it. So only thing we're usually looking for when we sell supplements is who's got the lowest price. Because because the coverage is identical. There's no difference. Okay, if we have ARC or Highmark or New Era or Aetna, a lot of people used to sell New Era, and people say, I don't want that company, I've never heard of it before. Well, it doesn't matter. Because when you call a doctor up to ask them if they take your policy, you're not calling and saying, do you take New Era? Do you take Aetna? Do you take Highmark? You're saying, do you take Medicare? And if they say yes, then your supplement is good there as well. So doctors don't even bill these companies. They bill Medicare. Medicare has it on file of who your supplement's with, and then they coordinate that. Okay? So the name of the card means nothing. We're just interested in who's got the best price for you. So let's talk about how you're covered. These are designed to pay almost everything that Medicare does. Okay? Those 4 gaps in Medicare. Yes? Yeah, that's what we recommend.
Is that prescription too?
No, prescriptions don't come with that. Let me go, that's a great question. So you see, when I have Plan N, G, and F here, usually when you come in, I'll quote you a price up there. That's where we put the premiums. And if you see prescription Part D, that's one thing about supplements, they don't come with prescriptions. Like HMOs and PPOs come with prescriptions already embedded in them, supplements don't. So you have to purchase a separate prescription drug plan that costs between $14 and $20 is what they normally cost. So, but these are designed to pay almost everything Medicare does not. And when I say everything, I mean if you took Plan G, the only bill you'd ever have would be a $185 deductible, and once you pay that, everything else is covered at 100%. Except your medications, that's a separate policy, right? Except your medications. Medications is like its own separate policy, whether you have a Medigap policy or even if you have an Advantage Plan, HMO or PPO, which we're going to talk about next. It's like its own separate policy, with its own separate costs and its own separate maximum of what you can pay and its own separate rules. Okay? So if you buy a Medigap policy, again, what we like about it is if you look at benefits, number one, is they're so simple. You pay your premiums and not much else. The only thing you're going to pay with Plan G is the deductible. And then once that deductible is met, you won't pay a doctor visit, a blood test, an x-ray, a CAT scan, an MRI, a hospitalization. It's all covered at 100%. With N, you would pay the same deductible and then 2 other co-pays, $20 at a doctor and $50 at the emergency room, but nothing else. So it's simple, simple, simple. God forbid you get cancer and you're in and out of the hospital and you have chemo and radiation. You don't have to worry about the bill that's coming in the mailbox. We know what's coming, 0. All of those services, I just rattled off. If you have a supplement, you will not pay a penny for it. Okay? You will not pay a penny for it. And Netta and Ron have, and Joan I think too, right? All have supplements. Yes?
Both needs replaced last year before, and I paid nothing. Went to a nursing facility afterwards and paid nothing.
So 2 need replaced, the surgery, the skilled nursing home, and the rehab, and she didn't pay a penny. Okay? If you'd had, so we're going to talk about the differences between HMOs. So again, number 1, we like them because they're simple. 2, we have the right to go to any doctor in the country. So we don't have to worry about this whole Highmark UPMC battle. You can go into West Virginia to Ruby Memorial, Mon if you want. If you're traveling, you're covered. Those guys travel to Florida. So Ron and Netta spend time in Florida. When they're there, they're covered, just like they're at home.
What about Texas?
Any state in the country. And Guam, Puerto Rico, so all 50 states plus any U.S. territories you would be covered. Okay? So I mentioned my clients that were 100 days in the hospital. One of them got a rare parasite from tainted romaine lettuce. There were only 2 hospitals in the country that could treat her. The Mayo Clinic and the Cleveland Clinic. She went to the Cleveland Clinic and stayed for 110 days and lived to tell about it. I touched the bill. It was $250,000. I touched it. She never paid a penny. And more importantly, she had the right to go to the Cleveland Clinic because if she'd had certain HMOs, they wouldn't have paid for that service there and she'd died. Okay, so to me that's probably one of the most important things is access, nationwide access. This is something people don't talk about, number 3. Medicare, not the insurance company, decides what's covered. There's nobody sitting down in the UPMC tower or the Highmark tower. There's people employed by insurance companies whose sole job is to deny claims. That's what they get paid to do. To deny an MRI, to deny a surgery. It doesn't happen that often, but it happens. Medicare doesn't work like that. The doctor decides what's covered. So if the doctor thinks you need an extra day in the hospital, you stay. If the doctor wants you to have an MRI, they can order the MRI and you can get it immediately. It doesn't need to be prior authorized. And number 4, benefits don't change on your supplement. So Annetta's had hers for, I don't know, 13 years now. Her benefits are the same as when she bought it. They don't raise copays, and they can't add any copays, all right? The negatives are they're expensive, right? When Annetta started, they were paying one figure, and now it's probably, since Ron had his, it's probably doubled.
He's paying 200 something.
Yeah, and it started with probably like 100, so like 110, 120. So they start around $100 at age 65, and for every year older than 65, you're at about $3, and that's what you're going to pay for them. So that's the negative. And they go up, once you turn 68, they go up every single year. So that's the negative. There's no vision, deaf, or hearing. So HMOs and PPOs offer a little bit of that. Supplements don't. You'll pay for your own eyeglasses, you'll pay for your own eye exam and your own teeth cleanings, x-rays, fillings, etc. And then the third negative is they're medically underwritten. Meaning if you have an HMO or PPO today and you want to get a supplement, I've got to ask you a series of medical questions. If you can't answer them all no, they don't have to accept you supplements. Okay, so they can deny you. So every year we get probably 200 people that come to us that want a supplement who can't get one because they've got some prior or current medical conditions, okay? If you have a supplement, you have 3 cards. You show 2 cards at a doctor, hospital, or lab, your Medicare and your supplement card, and you have a third for your prescriptions, okay? Any questions on supplements? All right. Let's move to the next page. These are advantage plans. All right. Look at the companies up there. These are 5 of the major companies. Highmark Freedom Blue, Aetna Coventry, Highmark Security Blue, UPMC for Life, United Healthcare Markets as AARP Complete, and there's also Community Blue. Those are the 6 major players in our area. There's 3 minor players, Humana, Gateway, and All Well. You'll get mail from those companies. They're kind of minor players. They don't really have a market in Western Pennsylvania right now. But those are the major players up top. How many people have an HMO or PPO? Do we have anybody? So we have some. Okay? So, advantage plans are known as Part C. Let me explain that. A is your hospital. B is your medical. D is your prescription. And C is an advantage plan. It's your right to privatize your Medicare. When you choose one of these plans, let's go back to the Medicare page, right? Let's go back to that first page. When you choose one of these companies, you are choosing to have Medicare take on a completely different role than what I explained to you when I first got started. Medicare stops paying 80% of your bill, and they stop paying your hospital bill. What they do instead is they pay, now let's go back to the Advantage Plan page. They pay these companies $800 a month to become your one and only insurance company. You can take your Medicare card and you can put it in a drawer or a safe or a file cabinet where you keep your birth certificate and other important documents because you don't show it anymore, right? When you go to the doctor, if you have an HMO or PPO, you don't show your Medicare card. Medicare is basically paying a company to get rid of you, for lack of a better way to put it. They're paying these companies to take on the burden of providing you providing you benefits and pay all the bills. The difference is you're going to participate a lot more in cost sharing. In other words, with advantage plans, unlike supplements, you're going to pay for doctor visits, blood tests, x-rays, CAT scans, MRIs, hospitalizations, surgical procedures, chemo, radiation, skilled nursing facility, all come with a cost. The more expensive ones like chemo and skilled nursing can be in the thousands of dollars. Okay? Now, why do people do it? Look at the cost. Because you can get them for nothing. That's why you do one of these. So we have about 3,000 clients with Advantage plans. Next year we will not sell an Advantage plan with just a handful of exceptions. We will not sell one that's over $60. If you're going to take one of these, you want a low-cost plan. That's the benefit of it. So let's talk about how you're covered with Advantage plans. They all, again, they're highly regulated. They all have to cover the same 29 categories of benefits. They all cover the same thing Medicare does. I don't care whether you pay $0 or $290, they all cover the same thing. There's 3 differences between plans and companies. What you pay, obviously. Number 2, what do you pay for the same medical service? So one of these companies up here has a plan that was very popular up till this year. If you spent 5 days in the hospital, the bill's $1,100. There's another company that has a premium that's lower. That same hospitalization is only $300. $800 less for the same exact medical service, and the premium's lower. Now, why does that happen? Because these companies they're going to get away with whatever they think they can get away with. If they think they can get enough people to enroll in their plan and make you pay $1,100 in the hospital instead of $300, that's what they do. Okay, so you've got to be the point is, these are not created equal. We like these plans, but you've got to make sure you got the right one. Okay, they're not all created equal by a long shot. The third difference is what you can be billed in a calendar year. It's called the maximum out of pocket. On the low end, it's $3,400. On the high end, it's $6,700. So we generally want our clients on the ones that are lower. Okay, $3,400 to $4,900 is where our clients are on those types of things. We'd like to keep it on that low end because, again, if you've got cancer, you're going to pay you're going to pay that maximum out of pocket, almost guaranteed. So if that happens, we don't want you to pay $6,700. We'd rather have you pay $3,400 or $4,000. Okay. So what's the benefits? Look at number one. Number one could be number 1, 2, 3, 4, and 5 because that's why you do this for the low cost. So for example, if the supplement costs $150, right? That is $1,800 a year. Over the course of 5 years, that's $9,000 you'll be spending in premium. If you take a low-cost plan, a zero plan or a $20 plan or a $40 plan, we have the opportunity over 5 years to save $6,000, $7,000, $8,000 in premiums if we stay healthy. Okay? If you're not healthy and you end up with cancer, you give all that money back. But I understand that's very tempting to do, and we have a lot of clients who say, I'm going to take a chance that I'm going to stay healthy because I have a chance to save a lot of money. Okay? 2, there's no underwriting in these. We can flip-flop companies every single year, and we do that. So if you're my client, you know you get a letter from us every year telling us what we're going to do. Okay? So this year we had a couple new plans come in the market, and we wrote our clients letters saying, you need to change plans because your plan is no longer as good as this plan. And you can come in and you can change, and it doesn't matter what kind of medical, you could be going through cancer, and you can change companies. And they have to accept you and pay claims on the day it starts, okay? Some plans have dental, vision, and hearing, and there's a company right now that's offering $2,000 next year in comprehensive dental benefits. And that's one of our most popular plans for this year and next year. So they will pay for cleanings, fillings, crowns, root canals, extraction, dentures, and implants up to $2,000. Okay? And they'll give you a little bit of eyeglasses and some hearing aid benefits. Many of these plans come with prescriptions, so you get your medical and your prescription all embedded in one, and the prescription plans are good. And then you get silver sneakers, which is a gym membership. You don't get those things with supplements, okay? Let's talk about the negatives. The best plans, we talked about the plans $60 or less, they're all HMOs. That means you must get your care from participating doctors, facilities, and hospitals. Now luckily, the UPMC Highmark thing got resolved. So I don't care what, you can go to both. Now, with the exception of UPMC, they don't cover Allegheny Health Networks, okay? But if you have certain plans of these, you can't go to the Mayo Clinic or Johns Hopkins University or the MD Anderson Cancer Center. You can only go to doctors and hospitals locally in our region for the most part. Now, UPMC and Aetna now cover the Cleveland Clinic. And UPMC covers Ruby, and so does Aetna. Premiums can go up on these plans, so you see their plans are $290. 12 years ago when I started, that $290 plan was $40. It's gone up. Now these companies have figured out that they don't want to raise your premiums because you'll leave them. They've kind of figured that out. So look at number 3, negative. So instead of raising your premiums, a lot of times they'll change your benefits. Okay, so they get you on the back end. So years and years ago, chemotherapy was covered in full with the exception of a $25 copay. Then all of a sudden, all these companies went to 20% of the cost. So you went from having chemo that was $35 copay to maybe having a $2,000 copay. It happened overnight. Now all the companies do that. So they can really change your benefits. Number 4, if you need chemo, skilled nursing, durable medical equipment, infused or injected drugs. I guarantee you most of you know somebody getting Remicade. It's an infusion therapy for rheumatoid arthritis and Crohn's disease. It costs $2,000 a pop. People get it every 6 weeks, and if you have an Advantage plan, it's 20% of the cost. So every time someone gets one of this who has an Advantage plan, they owe $400. Where with a supplement, that would be no cost. And number 5, once we enroll an Advantage plan, we may not be able to get back into a supplement. Because again, remember, supplements, if you want to switch to New Era, right, you can't switch if you've got pre-existing conditions. Now, once you're in a supplement, they can't kick you out. But if you have an Advantage plan and want to go to a supplement, we're going to ask you a series of medical questions, and again, they can deny your coverage. Okay? Any questions on the differences? Yes?
The cards that we get, why don't they have what you pay on it. Now, I used to
On a
go-
supplement?
I don't know.
What's your company?
Aetna. And I always go to the health store,
Do you-
so Sean always helps me.
So you show your Medicare card and your Aetna card?
Yeah, but it doesn't say what your medical.
Okay, that's because it doesn't say what your copays are.
Yes, that's right.
That's because you don't know what you're going to pay at the doctor because they don't know if A, you've met your deductible, or B, your copay is $20 for a doctor, right? Is that what you have? The plan has $20?
I used to have Security Blue and I loved it, and I couldn't change. I had to change because I couldn't go to Pittsburgh Hospital.
Right. Oh, that's right. You know what? I've got to have to look at your card, but they'll know if they'll know at the doctor's office what your copay is, and if they don't collect it, that means it's because they don't know what your bill's going to be. They don't know if if you have a deductible, they don't know if you've met it, and they don't know if your copay
Yeah,
is going to
they'll
be
say,
$20.
I'll send you the bill.
Yeah, and that's fine. There's nothing wrong with that. No, there's nothing wrong. I'd have to look at your card because Aetna has a supplement, and then Aetna also has an Advantage plan. So I'd have to see. Do you have an HMO or a PPO?
I don't know, I go to Sean does this.
John, you show your Medicare card and the Aetna card when you go, both cards, or you just show one card?
I'm at 2 cards.
You have a supplement then. So that's why it doesn't show on your card what you're. And again, if you need surgery, if you, God forbid, you wound up in a skilled nursing facility, if you went up in a hospital, you don't pay anything. When you had Security Blue, you had to pay for all that stuff. Okay? So that's the difference between the plans. And people love these when they're healthy, right? Everybody loves a zero premium plan when they're healthy because you're only paying $5 at a doctor and 25 at a, 35 at a specialist, and boy, it's wonderful. It's when you get sick that people don't like it. When you end up in a skilled nursing facility and get a bill for $4,200. That's when people don't like it. Okay? Any other questions? I'll be back later on today, once the symposium's over, to answer any questions if you guys, I know probably some of you aren't going to stick around for the whole thing, but I'll be back today. You can always call our office. Bonnie will have bags and stuff with our phone numbers on there if anybody has questions or want to come in for a consultation, okay? Thank you guys for being such a good audience. Any other questions? All right. Thanks, everybody.